The 6, 8, 9, 12 is angle screw channel. And then this ones we're going to sleep, so doctor will cement in the chair side after they put it back, the mortar unit, tie base. It's right here. It's finished this gray work. And the lower mini sighten, hybrid inside, and then we cement it together right here. Okay. Case. This is mini sighten 7-star case with design in here, and then a pack. And here is a 3-unit bridge design at the same time, so we made it before. And then here's the issue, so we're going to sleep. Now we're going to cut it. Here's a sturdy model. Okay, this is the angle screw channel. Using the grid, the 4, actually it's 8. There's no pink porcelain. Match it up. So usually I have to take it out the individual parts and then put it back to this area. Okay. And then repeat it. And also is another sighten 7 stars lower. And then made the framework design. You saw this our frame, the grinding chrome cover on top of this, and we made the 3-unit monolithically. In those areas we can fill with pink porcelain. We're not going to use the composite, so we're using only ceramic. Okay. So check this, and then the other one is I can take it out the individual parts, and then I can feed it to the here. You see? Okay. Same as the other side. Then I take it out. Screw channel, we have to using the different drive. So you have to carefully. Sorry, it's not here. Actually, this. So if not fitting, then I have to grinding internals just a little bit. Match it up. Yeah, that's it. Right? Just like that. Okay, so same as the other side. Okay, then we can check the occlusion contact. Then we can grinding tees here and there. This makes very symmetry. And then using the luster paste from CGI porcelain. Okay. Here's another case we finished it with angle screw channel involved it, and bios and tie base, because this side was really sticking out facially. So we discussed with the doctor, and we trying to sleep, which is doctor going to put in the patient's mouth exactly this tie base, and then screw in. They can cement here with the temp cement here. Angle screw channel and uni grips. So we finished the upper. Always make the great aesthetics, right? 3 screw channel. And doctor will going to put the temp cement here. And maybe not. They don't have to, because there's so many implants, 7 implants involved. They screw down. So, and the lower, you saw this previous my video, due to the bite. It's really tight. So we get the light. And dentist has two options, or a couple of options for these cases. First, they can do tie-base ears, which is cheapest way. If patient doesn't want to pay whatever. The problem is tie-base is not enough support all the way here. Okay, so they cause the tie-base failure when probably 1 year, 2 year, depends on the occlusion forces, depends on what patient's grinding from the different side. But I do notice it that the one side is, look at this grinding pattern, which is humongous. The cause will be problem. See the occlusion pattern, and then this one will be fail. So what other option is we can do the custom abutment, and then we can make individual crown. But these ones we will going to do the bridge. So you saw our frame design, which is Citon 7-star cases 1, 2, 3 to make the frame work, and then we scan again after the pack and scan again in design 2. So we make the separate monolithic, and then trying to match up to the other side as well. Okay, so we finish the lower like this. Okay, so completely monocolor block. Been using BND zirconia block, and top of that is more lighter. So we finish the kind of the complex cases with different implant types like that. Okay. So, and also Dr. gave us this great guidance for the pre-op temporary, which is existing patients wear it, the temporization. This is a great guidance, so we can make the successful case illustration just like that, and then finish is not only the aesthetics, a great hygiene here. This is never going to break. Okay, so even though by tights, whatever, but this one is a great option for this. Right. And also we give them the light guard as well. Cheers, always. So patient can wear it. Okay, thanks for watching this my video.